Good evening. My name is Dot Count Scoggins, and I'm Vice President of Quality Initiatives at Child Care Resources here in Charlotte. It is a private, nonprofit resource and referral agency which is based in Charlotte, and it serves children and families, early care and education programs, and professionals and communities across Mecklenburg, Union, Cabarrus, Stanley, and Rowan counties. Child Care Resources has worked 26 years plus to ensure that all children ages birth through 12 have access to affordable, high-quality early learning and school-age opportunities and experiences that enable them to succeed in school and in life. I am very concerned about the policy and budget changes that have been proposed in North Carolina legislature that I believe will decimate North Carolina's nationally recognized early childhood programs. A plethora of research findings underscore the critical importance of early learning experiences from ages birth through 5 on the lifeline success of adults and that children become. A growing unrefuted body of research has also documented the effectiveness of 2 of North Carolina's signature early education programs, Smart Start and More at 4, in helping children to come to school ready to succeed. Yet, representatives of the North Carolina House and Senate have proposed significant and devastating cuts and changes to these programs' structure and urgently require further study and correction. Specifically, North Carolina Senate proposed state budget cuts to early childhood programs, a total of $108 million, a 25% cut, impacting More at 4, Smart Start, Child Care Subsidy, and the Teach Early Childhood Scholarship Program. All of these programs are critical to supporting children, families, employers, and communities across to higher quality early learning opportunities that enable children to come to school ready for success and enable parents to participate in the workforce, knowing that their children are well cared for and assessing the learning experiences that help them to acquire the developmental skills that are needed. The state's budget should not be balanced at the disproportionate expense of young children and their families. The report, Early Childhood Education for All, a wise investment published by Legal Momentum and the MIT Workplace Center, may have summarized the case for investment in early care and education best when it reported, in a time of scarce public resources, the care and education of young children will continue to fall to the bottom of the priority list until there is a shift in public understanding about the economics of raising the next generation. High-quality early childhood education is too vital to be brushed aside as a social services expenditure for only a few families or as too expensive to consider in tight budgetary times. I am proud and privileged to be able to work in partnership with families, early care and education and school-age educators, public and private schools, employers, program operators, government, More at 4 and Smart Start, and other early childhood and school-age advocates and stakeholders throughout the region to maximize available resources. Despite this, in Mecklenburg County alone, at this particular time, there are more than 4,000 children on a waiting list for subsidized child care because the demand for child care subsidy exceeds the funds received for this purpose from federal and state resources. What I'd like for them to do is, number 1, limit funding reduction for either Smart Start or More at 4 to the percentage amount established by Governor Perdue for all other education programs. Number 2, use federal stimulus funding as required to support the child care needs of working families of children ages birth to 12 without supplanting state funding for another early childhood program. Number 3, use stimulus funds to serve more children and to enact a market rate increase for 4- and 5-star child care programs, particularly focused on rates for infant and toddlers. And delay restructuring of More at 4 and Smart Start until after July 2010, following the initiation and completion of a comprehensive study and consideration of findings and recommendations. Thank you.